This is an uncomplicated delivery of a baby. First, my PPE is on, scene is safe. I have the patient right here. I'm going to ask if she's had any previous pregnancies, looking at vital signs for hypertension, if I need to move the belly over a little bit, looking for O2 and other vital signs like the pulse rate. Then I'm going to ask the patient, has she taken any medication beforehand? And with the previous pregnancies, has there been any complications before, like a C-section or nuchal cord or anything like that? So then what I'm going to do after the clothes are off, I'm going to check for any dilation, ask about her contractions, if they're very intense and how regular they are. If I'm going to be seeing any dilation that's over 10, I'm going to be preparing for imminent delivery, as well as if there's any crowning. So then what I'm going to be doing is getting my obstetrical kit. I'm going to look for bulb suction, the knife or scissors that are sterile, the clamps, some gauze pads, and PPE, sterile PPE. So the gloves, the gown, the face mask, and shield. So I'm going to be putting that on, putting a towel under the belly or under the butt, putting 2 towels over the legs, and the scene is ready for delivery. So what's going to happen is I'm going to ask her to push every contraction, so intense push. Then what I'm going to have her do is, once the baby is crowning, I'm not going to be pulling on it. This is just for demonstration. So there's crowning of the head. I'm going to gently guide it out as it comes out. I'm not going to be pulling out, making sure that once I have it out here, I check for a nuchal cord here. I don't feel a nuchal cord. Then what I'm going to be doing is getting my bulb section, suctioning out the mouth for any secretions or meconium, the nose next, and then I'm going to be pushing down on the shoulder and pushing up on the bottom shoulder, so that we can gently guide the baby out until all other extremities are gone. I'm not going to be pulling on the umbilical cord or to get the placenta out. I'm going to be putting the baby on the belly and assessing for any retractions once I stimulate the bottom of the foot or tap it on the butt. I'm going to be wiping it off with any gauze and wrapping it in a towel. After about 1 minute, I'm going to be doing my APGAR, or 30 seconds, I'm going to be doing my APGAR assessment. That's appearance for 2 points. You have pink, warm and dry. For 1 point, it's going to be cyanosis in the extremities, and 0 for cyanosis everywhere. The pulse, it's going to be over 100 on the brachial artery, less than 100 with 1 point, and then no pulse is 0. Grimacing, full crying going on, and wincing at stimulation. 1 point if there's just a weak cry, and little wincing, and then unresponsive is 0. Patient activity, if it's spontaneous, like retractions or anything, it's going to be 2 points. 1 point for a little bit of wincing as we stimulate, and 0 for unresponsiveness. And for respirations, if they're crying spontaneously or coughing, that's 2. Weak cry is 1, and then 0 is unresponsive again. If I'm not having any of those go on, after 1 minute, I'm going to get my PPV, and we'll start bagging him. And after about 5 minutes, after another APGAR skill or score, I'm going to be thinking about intubations and an IO epinephrine. Now, after 1 minute, I'm going to be looking 6 inches from the stomach umbilical cord, clamping it down, and then 2 more inches I'm going to be clamping this down, and right in the middle with either my sterile scalpel or sterile scissors, I'm going to be cutting in between that. Again, if there's any hemorrhaging from the belt or from the vagina, I'm going to be putting a gauze on top and doing a fundal rub if there's a lot of hemorrhaging that's unexpected. But task complete.